Well, these findings show the very immediate impact that the cost of living crisis is having on the NHS, its staff and patients. So NHS staff have received below inflation pay awards over a period of years, and we're now seeing that as costs rise, they're facing some really difficult choices. So our surveys unearthed some heartrending stories. So, for example, a nurse who has chosen to skip meals on shifts so that they can pay for school uniforms back at home. We're hearing that people are worried about covering the costs of their commute into work, perhaps worrying about the cost of petrol if they're a mobile worker. And trust leaders tell us that the cost of living crisis is having a real chilling effect on recruiting staff into the NHS and also on retaining them. They're particularly worried about those members of staff who are on lower or moderate incomes, and they report seeing people leave for industries like hospitality or retail who can pay more competitive terms. In terms of the impact on patients, trusts are already seeing that people are coming forward with conditions that are exacerbated by the rising cost of living. So that might be if they have an underlying physical condition, which is exacerbated by being in a cold home or lack of access to nutritional food. We're also seeing an increase in presentations of people who've got worsened mental health challenges. And trusts are also talking to us about a number of people presenting to A&E, perhaps in crisis, perhaps in facing financial hardship, where their primary need might not be a medical one. Nonetheless, they're coming to the NHS, we're open 24/7, and they're seeking help. So this is all coming at a really challenging time. As you know, we are gearing up in the NHS for a difficult winter ahead, wanting to focus on reducing care backlogs. But trust leaders are worried that the cost of living crisis will shrink our workforce, essentially, and make the existing workforce challenges that we face worse. They're also really worried about the impact on patients and communities.
Okay, and obviously I presume working in the NHS is a unique role, but a very rewarding one. It must be a big decision for people to actually consider leaving the profession and going into something quite different. What do you think is going through their minds, and why do you think they're being pushed into what must be quite a difficult choice?
Absolutely. In the NHS at the moment, we're operating with over 130,000 vacancies in the trust sector alone. And it's a bit of a self-fulfilling prophecy. For every vacancy, places more pressure on existing teams in the service and makes their job and their working environment more difficult. So we do really need to work with government to plan much more effectively, much further ahead, to get in the doctors and nurses that we need to meet demand, which has been rising consistently. So there's absolutely a lot that trusts can do as local employers. And we've heard a lot of stories of trusts really leaning in to support their staff during the cost of living. So increasing numbers of food banks being offered on site in hospitals and other care settings. Trusts are offering access to advice for their staff around financial management, debt management. Some of them are offering hardship funds, making sure there's a £1 meal on the menu in canteens. But there is only so much that trusts can do. So they're also looking to government to act to bring down inflation and for cross-government support to address the causes of poverty and its health consequences.
And you mentioned that all of this is coming at a difficult time for the NHS already. How concerned are you that the cost of living crisis might put off future people from considering a career in the health service?
Well, trust leaders report that they're already seeing a chilling effect related to the cost of living crisis. So I think that's anecdotal at the moment. It hasn't necessarily come through into the data, but they are reporting that they're seeing that chilling effect with new starters. And in addition to that, we know that larger numbers of some of our more experienced staff are leaving the NHS. So while the net workforce figures might look relatively stable, that does mask some worrying trends that we're seeing more people leave, often citing the stress of the pandemic or difficult working conditions. And a lot of those people are the more experienced staff who would have mentored and helped supervise and develop new joiners. All of this is happening at a time when demand is rising, and we actually need more doctors, nurses, health professionals, and at a time when we really want to bear down on the care backlogs generated during the pandemic and reduce waiting times for patients.